Hi, welcome. Thank you for watching Respiratory Confidence Bootcamp. We are so glad you are. While you're here, support us by subscribing, sharing, liking, and leaving a comment on this video. This helps us dedicate our time to you more exclusively. Let's learn with purpose and leave with confidence.
All right, let's dive into the specifics of ABG interpretation. ABGs are a snapshot of how well a patient's body is managing oxygen, carbon dioxide, and pH levels. But sometimes, when things go wrong, they can tell us a lot about whether a condition is acute, chronic, or even a combination of both. Let's start by understanding what normal ABG values look like, so we can tell when things are out of balance. Here are the values we need in order to make proper decisions. Pause this video now and fill out the proper ranges by memory. Then check your answers. All right, here are our normal values. pH, 7.35 to 7.45, PaCO2, 35 to 45 millimeters of mercury, bicarbonate, 22 to 26 milliequivalents per liter, PaO2, 80 to 100 millimeters of mercury. Now let's see what happens when things go wrong and how it reflects on the ABG. Uncompensated, acute conditions. When a condition is uncompensated, it means the body has not had time to adapt, and the ABGs will show a clear imbalance without compensation. In this case, either the pH, PaCO2, or bicarbonate is out of normal range, and there's no adjustment yet to bring things back into balance. PaO2 will primarily tell us the oxygenation ability of our patient, so even though right now we're talking about components for compensation, including whether or not there is hyperoxia or hypoxia in the result is still part of the overall interpretation of the blood gas. I don't want you to forget that. Let's move on. Here's an example we have. pH 7.28, low, acidotic. PaCO2, 60 millimeters of mercury, high, indicating retention of CO2. Bicarbonate, 24 milliequivalents per liter, normal, no compensation yet. In this scenario, the PaCO2 is high because the lungs can't blow off enough carbon dioxide due to airway obstruction. The pH is low, indicating acidosis, but the kidneys haven't had time to compensate by raising the bicarbonate. This is a compensated acidosis due to the acute respiratory problem. Pause this video and ask yourself, what conditions could result in values like this? If the PaO2 was 60 millimeters of mercury, if you said any of the following, you're correct. Compensated, chronic conditions. In chronic conditions, the body has had time to adjust and compensate for the problem. The pH remains relatively normal, but you'll see compensatory changes in PaCO2 or bicarb as the body tries to balance things out. However, these compensations can't always bring everything completely back to normal. Here's the example. pH 7.38, normal, but on the low side. PaCO2, 55 millimeters of mercury, high, indicating chronic CO2 retention. Bicarb, 32 MEq per liter, high, compensating for the CO2 buildup. In this case, the body has had years to adjust, so the kidneys have increased bicarbonate to buffer the acidosis caused by the CO2 retention. The pH is relatively normal due to this compensation, but it's not a perfect balance. Pause and write down the conditions that may cause this result. What would this entire status base be named as? Wow, I'm impressed. You're doing really well with ABG analysis so far. If we didn't name anything here you identified, leave a comment for our RT community. Now we are closing off with the last topic today, acute on chronic conditions. When you have an acute on chronic condition, it means the patient already has a chronic issue, and now something acute, like an infection or another illness, has worsened the situation. the body's compensation mechanisms may be overwhelmed, and you'll see both acute and chronic changes in the ABG. Here's our last example. pH, 7.30, low acidotic. PaCO2, 70 millimeters of mercury, very high acute CO2 retention. Bicarb, 32 milliequivalents per liter, elevated chronic compensation for CO2 retention. Here, the PaCO2 is markedly elevated due to the acute pneumonia exacerbating the COPD. The kidneys have tried to compensate over time, so the bicarb is high due to the chronic respiratory acidosis. Conditions like COPD, but having an additional acute illness play a part here, like pneumonia. So when we look at ABGs, the key is to figure out whether the body is just starting to struggle, acute, already adapting to a chronic problem, compensated, or facing a new problem on top of a chronic condition, acute on chronic. To recap, uncompensated, no time for the body to adjust. ABGs will show significant imbalances. Compensated, the body has adapted, but compensation may not bring everything back to normal. Acute on chronic, a chronic condition worsened by an acute event, leading to more severe ABG imbalances. I know ABG interpretation can seem like a lot to absorb, but once you understand the underlying principles, it makes more sense. Hey everyone, it's Nina, your RT preceptor for today. I just wanted to say it's been awesome connecting with you all. If you love what we're doing and want to help support our channel, consider donating to keep this amazing community of educators going. It takes a lot of time, effort, and resources to make these videos happen, so any contribution would be huge. Also, don't forget to check out our tutoring services. Our team of experienced pros is here to help, and we're all about boosting your confidence in respiratory therapy. Speaking of confidence, our RT Confidence Bootcamp is launching in 2026, and you won't want to miss it. For more info, shoot us an email at respiratoryconfidencebc@gmail.com and be sure to follow us on social media. Can't wait to see you again soon.